Oh, hello there. Please come on in and make yourself comfortable. My name is Bryoni. And what made you make this appointment today? Right, okay. So you're just feeling a little bit under the weather? Okay. Well, what I will do, I will just carry out a few little checks. Almost like a cranial nerve exam. Okay, just see how well you respond. Okay? Alright. First of all, I am just going to feel around of your face. Okay? I just want to check your muscles and your facial nerve. Alright? Wonderful. Just let me know if you have any pain or discomfort. Just going to massage. Any pain around your ears? In your head? Okay. Alright, that sounds fine. Could you now just smile for me? And frown. Just want to check your movements. Okay, I'm just going to hold your chin. Any pain? No. Wonderful. And now just move your head from side to side for me. And up and down. Excellent. Okay. Do you have any pain or discomfort around? No. I'm just going to feel. Feels okay. Alright. I'm just going to feel your chest and your tummy. Okay? Feels okay in your tummy. Make sure it's not tender or anything. Okay. Just take a nice deep breath in for me. And out. Take a nice deep breath in. And out. Wonderful. Okay. I'm just going to have a little listen. Okay. I'm just going to put this one on your chest. Wonderful. Breathe normally for me. Good. Good. You don't sound congested or anything. Everything sounds normal. I'm just going to put this one on your back. Yeah, that sounds absolutely fine. Now I'm going to pop this on your chest. Just take a nice deep breath in. Now. And out. Very good. Take a nice deep breath in. And out. Wonderful. Everything sounds fine. I'm not concerned at all. Okay? Great. Now do let me know if at any point you have any pain or discomfort. Okay? Wonderful. Okay. What I'm going to do, I'm just going to have a little look into your eyes. Okay? So, just look over here for me. The light can be bright. So do not look at the light. Look at my fingers. Okay. Look at my fingers. Wonderful. Okay. Good. Alright. Look at my fingers this side. Look over here. Good. just look at my nose. Wonderful. Okay, just look up for me. Now look down. Okay, look that way. Perfect. Look the other way. Just gonna have a little look. Alright, just look at the light. 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 I'm going to take the light out of your vision. Tell me when you can see the light, okay? Good. Very good. 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 Wonderful. I'm just going to cover your eyes. And now look at the light. Good. Look at the light. Look at the light. Look at the light. Wonderful. Now please just follow the light. Follow the light for me. Very good. Wonderful. Okay. I'm going to use a bright light. Okay. Look at the light. 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 Very good. Okay. I'm just going to have a little look into your nose. Alright. Just head up. Wonderful. Good. Nose looks fine. Do you suffer from any nosebleeds? Okay. Alright, looks fine. Could you just do this for me? That's it, do it again. Wonderful. Okay. What I am going to do, I'm just going to get you to smell this for me. Just want to check your sense of smell. Just smell that. What does that smell like? Perfect, spot on, well done. Okay, I'm now just going to have a little look into your mouth. So open wide. Looks a little bit red, but not much out of the ordinary. Comes like a fine, deep like a fine. It's moist. just lift your tongue for me. And just say, ah. Ah, very good. Open wide. I want to have a look at your tonsils. Very good. Okay, that looks fine. What I would like you to do, I would like you to taste this other one, okay? Do you have any allergies? No, that's fine. This will be okay. Alright, so stick your tongue out for me. Ready? Tongue out. Up. One more. What does that taste like? Perfect. Your taste is absolutely fine as well. Okay, I'm just going to have a little look into your ears. Just turn for me. I just want to have a little look around your ears first. That is fine. Okay, then the other side. What I'm going to do, I'm just going to use my otoscope. Okay. Just going to have a little look into your ear. Tiny little bit of build-up, but nothing that I'm concerned about. Perfect. Now this side. Okay. I'm just going to whisper in each ear and just repeat back to me what I say. Alright? Blue, yellow, pink, green. Wonderful. Cat, dog, mouse, bat. Great. Alright. Everything looks fine actually, but what I am just going to check very quickly is your oxygen saturation levels. So just pop your finger in there. That's it. Like so. And just take a nice couple deep breaths in for me. Good. And again. Wonderful. So your oxygen saturation level is 98%, which is very good. Anything above 96% I would be happy with. Just take that one off. Thank you. And lastly, I'm just going to check your temperature. Okay, so alright, look straight at me. I'm going to pop it on your forehead. Your temperature is 36.9, so that is absolutely fine. Okay, well, I have checked you over and I actually think you are clinically well. I'm not concerned at all. What you've been experiencing, I'd say you need plenty of rest. Okay, you might just be getting over something, perhaps a cold or flu. Okay, but I feel like you're in the final stages and I'm not particularly concerned. You could just have some home remedies. Okay, drink lots of clear fluids, water, keep yourself hydrated, get plenty of rest, have something nice to eat. I'd suggest perhaps soup. It's always good for when you're feeling a little bit low. Yes, but just have some home remedies that will just soothe your throat, but you're absolutely fine, you're not congested or anything, okay? I feel like you're at the worst of it though. Alright, Well, take care. And if it gets worse, please do come back. Okay? Wonderful. Alright, it was lovely seeing you. Goodbye. Hello everybody. Hello. Hello. This video is a little bit different. Now I am going to try and give you tingles, but this is sorry to disturb you, but the doctor would like me just to check your general observations. Okay. So just confirm your full name for me again. I have to write it down. Yep. And your date of birth, please. Perfect. So I'm just going to check your temperature, your heart rate, your respiratory rate, your oxygen saturation levels, and your blood pressure. Okay? Wonderful. Please just make yourself comfortable. Okay. So to begin with, I'm just going to check your respiration rate. So this is how many times you take a deep breath in and out in a minute. Okay? So just breathe as normal. Okay? Just relax where you are. Alright. Okay, so about 16, 17, so I'll pop 17 down. So a normal respiration rate should probably be between about 14 maybe to about 20. Really depends if you're awake or not, depending on how much, but probably 14, 13 to 15 sort of minimum, and up to about 20 will be okay. So next up, I'm just gonna check your temperature. Okay, this won't take very long. I have got a new piece of equipment here, so this one just goes up on your forehead. Okay, so it's straight and easy. Alright, so I'm just gonna hold this up to you. .2, so you are a little bit warm, but I'm not too concerned. So 37.2, so anywhere between probably 36.1 to about 37.3 or 4 should be okay. Anything lower than 36.1 means your body is cold. Anything above 37.4, I'd be quite concerned you might be in a fever, not feeling unwell, but you're okay. 37.2 is alright. It's okay. There's no concerns. Alright? Wonderful. So, next up, I've got a oxygen saturation meter, an oximeter here, and all you have to do is pop your finger in here, just like this, and this will tell you what your oxygen saturation levels are. Now this does also show your heart rate, but I will check that manually as well. Okay? Wonderful. So, if you could just pop your finger in there for me. Great. I'm just going to hold that. It can take about 10 seconds to fully read. Okay, so your oxygen saturation levels are 97%, which are absolutely fine. Normal oxygen saturation levels is between 96% to 100%. Okay, so you're absolutely fine. And your heart rate is looking at 86, so that's absolutely fine as well. Anything up to about 90 to 100 is probably getting on a bit high, but anything up to that is fine. And honestly, I wouldn't be concerned unless you were sort of below 60, below 55. Okay, so 86 is very good. So we're just going to take that one off. I'm just going to write that down. So your heart rate is 86 on the automatic one, and your SATs is 97%. So far everything's looking fine. Now I am just going to check your heart rate manually. Okay? So I just need your wrist. I'm just going to have a little feel for your pulse. Yep, I've got it. Okay, so just stay nice and still for me. Okay, I got 81, so it's kind of similar. So let's just write that down. Alright, it's 81 manually. Wonderful. Okay, and finally I just need to check your blood pressure. Okay, so I will use my automatic machine. Just makes it a little bit easier. So it just looks like this. So if you can, I want you just to pop your arm in there for me. So slide that on. Keep the tube in closer to your artery, just there. Wonderful. Yep, that's great. Okay, I'm just going to connect it. Okay, so then just keep that straight. Lovely. Alright, we're just going to turn this one on, and it should soon start to inflate. There you go. Okay, so just relax for me. That's it. Perfect. So it's just working it out. How do you feel at the moment? Dizzy or anything? No, you feel okay. Alright. Let's have a little look. Okay. So your blood pressure is 96/74 and your heart rate says 78, so that's okay. It's all pretty much aligned. So your blood pressure is on the lowest side, 96/74. Let's take this one off. Lovely. Let's pop that there. So 96 over 74. Alright, so a normal blood pressure should be about 120 systolic over 80 diastolic. Okay, so you're on the bit on the lower side, but I think you need to have something to eat, something to drink, and then a nice early night, okay? But I'm not too concerned, you're not symptomatic and you usually do have a low blood pressure. If it was sort of on the low 90s, I would be a bit more concerned, but I'm not too concerned at the moment, okay? Great. Well, that's everything that I need, okay? And the doctor will be around shortly, okay, to do their rounds, but all of your observations are okay at the moment, alright? Wonderful. Well, take care, and I'll see you again, no doubt. Alright. You're welcome. Bye-bye. Bye-bye. next patient, please? Thank you. Hello there. My name's Bryoni. How are you? Good. Please make yourself comfortable. Okay. So, before we get started with your appointment, I have a medical form to fill out for you. I've had a little look and we don't seem to have one for you, so it will just take a few minutes just to go through everything to make sure all your medical history is up to date. Okay, so there'll be quite a lot of personal questions in here. I have to ask you them. They might sound silly, but please just answer them truthfully for me, as this can impact your medical care that you receive. Okay? And then once we've done this, we'll go through and I'll just check how you are, and I'll just do a few tests. Okay? Wonderful. So first of all, could I just take your first name? Yep. Wonderful. And your last name? Great. Do you have a middle name? You do, okay. Yeah. Perfect, thank you. And what's your date of birth? Yep. Yep. Perfect, thank you. And your gender? I didn't want to presume, but okay. Lovely. Okay, and your marital status? Perfect, thank you. So I just need the first line of your address. Yep. Is that with an S? I thought so. Okay, and what's the postcode? Wonderful, yep. Great. And could I just take a mobile number? Yep. Yep. Great. And what's your email address? Yep. Yep. Okay. .com? Okay. Perfect. So, I do need your emergency contact. Okay. So, could I take the full name? Yep. And what's that relationship to you? Okay. Great. That's fine. Do you know their mobile or email? Not a problem. That's fine. Okay. So, do you have insurance? Wonderful. Okay. Great. So I'm now just going to ask you about your medical history, and some of this I do know. I've seen you before, but it's just to make sure everything's up to date. Okay? So, are you allergic to any medications? Okay. Yep. Great. And do you have any other allergies that I need to be aware of? Okay. Great. That's fine. So we've got the next page. So, these ones are a bit personal, but of course I have to ask you them. Have you ever been diagnosed with any of the following conditions? So, these are cardiovascular conditions, so high blood pressure, okay, heart disease, heart attack, stroke, or high cholesterol. Okay. These are respiratory, asthma, chronic obstructive pulmonary disease, this is COPD, or sleep apnea. Okay. Wonderful. So we're going to now look at the endocrine, so diabetes, type 1 or type 2, or any thyroid issues. Okay. How about pre-diabetic? Okay. Lovely. Do you suffer from ulcers or liver disease or irritable bowel syndrome, IBS? Okay. So, do you get any seizures or migraines or severe headaches? Okay. Lovely, thank you. Now, do you get anxiety? Okay. And is this social? Okay. What triggers anxiety for you? Okay. Thank you. And do you have arthritis, osteoporosis, or chronic back pain? Okay. Do you suffer from anemia or blood clots? Okay, that's good. Have you had any surgeries? Okay, how about hospitalizations? Alright. Has any of your family ever been diagnosed with heart disease, high blood pressure, stroke, diabetes, or any genetic disorders? Okay. Alright. Now, do you smoke or use tobacco products? Do you consume alcohol? What's the frequency? Okay. Alright. Now, do you use recreational drugs? Okay. How is your exercise? Do you exercise occasionally, regularly? So, let's say you walk every single day. How long would you walk for? Okay. What's your step count daily? Okay. Lovely. And are your immunisations up to date? All of your vaccines? Brilliant. Okay, so do you currently have any of these following symptoms? Okay. Unexplained weight loss or gain, fever, fatigue, or night sweats. Okay. Any rashes or itching, changes in moles, Okay. Any headaches? Vision changes? Hearing loss? A sore throat? Okay. Do you get chest pain, palpitations, or swelling of your legs? Okay. Any shortness of breath, chronic cough, or wheezing? Okay. Any abdominal pain, nausea or vomiting, diarrhea or constipation? Okay. Do you find yourself frequently urinating? Okay. Is it painful when you urinate? Okay. Do you ever find blood in your urine? Okay. Nearly there. Do you suffer from joint pain, muscle weakness, or back pain? Okay. Now, do you get dizzy, memory loss, or numbness and tingling anywhere? Okay. And are you currently feeling anxious? Okay. Great. We're nearly there. So, are you pregnant at the moment or planning on getting pregnant? Okay. Sorry, I have to ask. Alright. Like I said, these might seem silly, but I still have to ask you these questions, okay? So, we can now get on to okay, so we're nearly there. Do you have any other concerns or conditions that I've not mentioned to you that you are perhaps suffering with, or you have any concerns about? Okay. And are you currently in any pain at all? Okay. Lovely. Well, that's the form completed, so we will get that up to date on our system. So thank you so much for filling out this one. So how can I help you today? Why did you make this appointment? Okay. You just feel a little bit under the weather. That's absolutely fine. And you'd like some reassurance, wouldn't you? Just to make sure everything's okay. Yeah, that's alright. Nothing to be ashamed of, okay? At any point, if you'd like to come back to see me, you can, okay? If you just want to know that everything's fine, it's alright. So, what we are going to do, just to help relieve that tension and hopefully reduce your anxiety a little bit, what I would like you to do is just take a nice deep breath in for me. Okay, so deep breath in and out. Okay, nice deep breath in and out. Very good. Take a nice deep breath in and out. Wonderful. Take a nice deep breath in and out. Very good. Okay, I'm gonna have a little listen of your chest now. So I will need you to pop your top up, okay, just so I can have a really good listen. So I'm just gonna pop this one on your chest, okay? Good. sounds fine. Again, good. Just gonna pop this on your back. Again, good. Back on your front. Good. Again, very good. Okay, now take a nice deep breath in. Yep. And out. Good. Take a nice deep breath in. And out. Wonderful. You're going to do that again for me. Take a nice deep breath in. And out. Good. Take a nice deep breath in. And out. Perfect. Well, your breathing is absolutely fine. You have nothing to worry about. You don't sound congested or anything, and everything generally sounds okay. You're not wheezing, you're not blocked or anything. Honestly, you're absolutely fine. So what I would like you to do now, I'm just going to check your oxygen saturation levels, okay? So all I require you to do is just pop your finger in here, and it will work within a few seconds. Now it will tell me your heart rate as well, okay? Wonderful. So just pop your finger in there for me. Good, and we're just going to wait for that one. So a normal oxygen saturation should be between 96% and 100%, okay? I have no doubt you'll be able to reach that. Take a deep breath in and out. Perfect. Your oxygen saturation level is 97% and your heart rate is 88, so that's okay. That's good. Alright. I expect it to be a little bit high since you're at the doctor's. Alright. Just take that one off you. Now I'm just going to check your temperature very quickly. Just look straight at me. This is just going to go into your forehead. Okay. You want me to show you on me first? Alright, so I'm just going to do this. So I'm 36.3. Okay. It is a bit cold in here, so yeah. Alright, ready? You're 36.5, so you're pretty perfect. Okay. Next up, I'm just going to have a little look at your eyes. So I have got a bright light here. Please do not look at it. Look over here for me. Look over here. Okay. Keep looking at my fingers. Good. Now look over here. Wonderful. Okay. Alright, now look over here for me. Keep looking at my fingers. Okay. Look at my fingers. Do not look at the light. Good. Your response is great. I'm not concerned at all. Wonderful. Now just look at this light for me. Look at this light. Look at the 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 light. The light. Look at the light. Good. Could you now just follow the light for me? Just follow it. Keep your eyes on the light. Keep your eyes light. Wonderful. Good. Okay. Well, I don't think there's anything I'm concerned about. I think perhaps you need good early night's sleep, plenty of clear fluids, so water, perhaps something to eat. It might make you feel a bit better, give you a bit more energy. Okay. Now if you are feeling a little bit under the weather, you could just take a paracetamol, just one, just to keep everything on edge. Yes, just to get rid of your headache. But obviously you don't want to depend on them. So if your symptoms get worse, please do come back. Okay? Yes. Alright. Well, take care. And if you need to come back and see me, please do. It's always a pleasure. Alright? But you're absolutely fine for now, okay? You might just have something, a cold or something coming along. Yeah. Alright? Wonderful. Well, take care, and I'll see you soon. Alright. Bye-bye. 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 Oh, hello there. Please, come on in and make yourself comfortable. My name is Bryoni. How are you? Good, good. So you're here for a colour blindness deficiency check, is that correct? Wonderful. So I understand you've had numerous eye tests. Alright. Well, this isn't going to take too long. There's a couple of things I will check. It's very windy and raining outside, but you're in the warm now. So I will be checking your eyes with a few different lights. And then I will show you some charts, okay? Which is the main portion of the deficiency check. And then I will just test you using some coloured pens and just to see how well you respond. Okay? Great. Alright. So, I am going to start with a very bright light first of all. Okay? And I just want to see how well your eyes can tolerate it. So just look at the light here. If it's too bright, just look away every now and again, okay? What's the main colour of the light? Okay. Good. Alright, now just look at the light for me. Okay, look at the light. 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 Very good. Look at the light. 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 Perfect. Well done. So now we're going to do the same with this light. So just tell me what the main colour of the light is. It's extremely windy outside. Very good. Okay, so look at the light. 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 Okay, well done. So next up, I have a different kind of light. Just tell me what the main color of the light is. Okay. Would you say this one's more warmer or cooler than the others? Warmer. Okay. And how does this one feel for your eyes? Is it a bit better? Wonderful. So just look at the light for me. Good. Look at the light. 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 Very good. Okay. So I've got two different charts that I'm going to be trying with you. Now this one is just basically just different colours. So I will point to one and I want you to tell me what the colour is. Okay, just describe it the best you can. Alright? So what's this one? Good. How about this one? Good. Well done. Okay. What about this colour? Good. What about this one? Great. Well done. What about this colour? Good. This colour? Okay. How about this colour? What's it a shade of? Wonderful. Okay. What about this colour? Good. This colour? Good. This colour? Good. What colour is this one here at the bottom? Okay. Alright. What colour is this one? Good. What colour is this one? Good. What colour is this one? Alright. You're doing really well. Okay. Now, what colour is this one? Good. What colour is this? Good. What colour is this? tell me what colour this one is? Perfect. Well done. And which colour is this one? What colour is this? Good. 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 What colour is this one? Wonderful. And what colour is this one? Perfect. Well done. You've done very well there, actually. So the next one is the visual book to check for any colour blindness. Okay. Alright. Well, are you ready? Yeah? Okay. So, what I would need you to do is just tell me what number you can see in this circle. Okay. I'll help you out. So the background is green in this one and the number is orange. So what number can you see? 12. Very good. Okay. The next one. What number can you see in here? It's a bit more tricky to see. It's 6. Okay. This one's quite difficult. Could you do this one for me? Okay. How about this one? It's 5. Good. Let's try both of these. Can you do this one first? Alright. And what about this one? Okay. How about this one? Okay. You seem to struggle a little bit on these ones, but that's okay. These are designed to be difficult. Can you do this one on the other side? Alright. It's 6. Okay. How about both of these? Can you do this one? Alright, and how about this one? Okay. Can you do both of these? So this one and this one. Okay. What's this one? Alright. They're getting tricky, aren't they? Okay. What do you see in here? This one? What do you see? Okay. How about this one? What number do you see? Okay. And how about these two? So what number do you see here? It's 35. And what number do you see in here? It's 96. Okay. Let's do a few more. What do you see in this one? Okay. And the last one, what do you see here? Very good. Well done. You did really, really well there. Okay, so finally, I would like you just to tell me what colour this pen is, the lid. Blue. And what colour is this one? Green. Okay. What I would like you to do is follow the green pen, okay? So keep your eye on the green pen. Very good. Excellent, well done. Okay, now I want you to follow the blue pen, okay? Follow the blue pen. Follow the blue pen. Perfect. Well done. Well, you have done extremely well today. I don't think there's too much of an issue. If you feel like it does get worse or you develop anything, please do come back to see me and I can do a thorough check and do some more different tests. Okay? Wonderful. Well, take care and I'll see you soon. Bye-bye. 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 Oh, hello there. Please come on in and take a seat for me just there. I'm just finishing up my last report. I won't be a moment. Just make yourself as comfortable as you can. Alright. There we go. Okay. So, before we begin, I just need you to confirm your full name. Just grab your notes. Yep, and your date of birth. Perfect. Thank you. So, could you just tell me a little bit about why you decided to make an appointment today? Okay. when was your last appointment? Okay. Okay. And have you been having any particular symptoms or anything? Okay. Have you been experiencing any dizziness? Okay. Any headaches or migraines? Okay. How about any sort of minor chest pain or shortness of breath? Okay. Alright. And your vision is fine, no blurred vision, no double vision? Okay. Alright, is there anything you think I need to be aware of? Any changes in your lifestyle, diet, medication? Okay. Alright. Well, I think I have everything. I think you're right. I don't think there's anything to worry about, but it's very important to get yourself checked over. So I will just do a little check just to make sure I'm happy with everything. And hopefully everything's fine. Alright? So, to begin with, what I would like you to do is just take a nice deep breath in for me, okay? Deep breath in and out. Very good. Take a nice deep breath in for me and out. That's it. I want you to do one more, okay? Deep breath in and out. Very good. Okay. What I would like you to do now is take a deep breath in, hold, and exhale, okay? Ready? Deep breath in, hold, and out. Very good. We're going to do that again, but I want you to hold for longer this time, okay? So, deep breath in, hold, and out. Perfect. That's very good. Just breathe normally for me now. I'm going to have a little listen of your chest, just to make sure everything's fine. I'm just going to use my stethoscope. I'm just going to pop this here. Just breathe normally for me. Very good. Okay, that sounds fine. Keep breathing normally. Okay. I'm just going to pop this one behind you. Breathe normally. Okay. Now what I would like you to do is take a nice deep breath in, but when I say, okay? So breathe normally. Okay, take a nice deep breath in and out. Very good. Breathe normally. Okay, take a nice deep breath in and out. Very good. Okay, I would like you to do that again, but I want you to hold it this time, okay? So deep breath in, hold, and out. Very good. Okay, what I would like you to do now is just pant like a dog. So just like that, okay? Ready? Pant like a dog. Okay, stop. Breathe normally. Okay, pant like a dog. Alright. Everything sounds completely normal. You have absolutely nothing to worry about. Okay. Alright. What I am just going to check quickly is your temperature. Okay. Now this one just goes up on your forehead. Okay. You want me to show you? Alright, so we'll literally just pop it on. And for example, like that. And I'm 36.4. Okay. Is it okay if I do it for yourself? Okay, great. So, ready? Keep still for me. Let's try that again. You are 36.8, so you're fine. Okay. what I just want to do, I just want to check your oxygen saturation levels, okay? So I need you to pop your finger in here for me, just like that, and it will tell me your heart rate and your oxygen saturation, alright? So just pop your finger in there, let's turn that on. Great, pop your finger in there for me. Wonderful. So your normal oxygen saturation should be above 96%, and your heart rate for you, I think it'll be about 70 to 90, just based on your medical history. So let's have a little look. Your saturation is 98%, that's excellent, and your heart rate is about 74, so that's absolutely fine. Okay, let's take that one off. Thank you. Alright, what I'm going to do, I'm just going to pop these gloves on, and I'm going to just have a little feel around of your body, okay? I just want to make sure you're not in any pain or discomfort and everything's fine. Is that okay? So I'm just going to touch your face, your head, your neck, your shoulders, your arms, and just your legs, okay? And I do want to pop some pressure on your tummy as well, okay? Alright, so I'm just going to start with your face, okay? If you do have any pain or discomfort, please let me know. Alright, just going to touch your head and your ears. Do your ears feel fine? Good. Just touch it. Okay, I'm just going to touch you. Any pain or discomfort? Okay, good. You've got no swollen lymph nodes or anything. That's fine. Alright, I'm just going to touch your shoulders. Any pain or discomfort? Alright, good. I'm just going to touch your arm. Any pain or discomfort? No, okay. That feels okay. And the other arm. That's it. Just want to make sure everything's fine with you. Perfect. Any pain or discomfort? Great. Now I'm just going to touch your thighs, okay, and your knees, just as you're sitting. Alright, just tell me if you've got any pain, just touching your thigh. Any pain? Nope. And your knee. Any pain at all? No? Good. Okay. And the other side. Any pain or discomfort? Your knee? All good? Perfect. Alright, I'm just going to touch your chest and make my way down to your tummy, okay? Touch your chest, and now your tummy. I'm just going to put some pressure on your tummy. Okay, could you just cough for me? Alright, and cough again. Good. Tummy feels fine. That's all alright. Okay, I'm just going to touch your face like this and just tell me if it's sensitive at all, okay? Any really sensitive spots? No? Perfect. Alright, what I'm going to do, I'm going to have a little look into your eyes with my light, okay? Just look over here, do not look at the light, okay? Do not look at the light. Alright. Just want to check your pupil response. That's fine. Alright, and the other side, just look over here for me. Okay. Alright. Okay, your eyes look okay. Could you just look up for me? Look up. Good. Now look down. And look that way. And look the other way. Good, okay. I'm just going to open this eye. That one's fine. Okay. Alright, just blink for me. It can be a bit bright. You feel okay? Not dizzy? Alright. Just look at the light. 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 Okay, just follow this light for me. Follow the light. Very good. Keep following the light. Okay. How do your eyes feel? Okay. What I'm going to do, I've got a brighter light here. Okay. Now just look at this light. Okay. Look at the light. Look at the light. Look at the light. Look at the light. How does this one feel in your eyes? Okay. Look at the light. Alright, could you just follow this light for me? Keep following the light. Okay. Well done, you're doing really well. Okay, just blink for me. How does your eyes feel? Do you have a headache or dizziness? Okay, I thought so. So, I think you might have sort of be sensitive to light. Okay, now this is quite common. Okay, so I don't want you to worry too much. What I will do, I will get you a referral just to get your eyes tested. Okay, and hopefully we can get some glasses. We can get ones fitted with a reflector and blue light, so hopefully it will help you. But I don't think there's anything particular wrong with your vision as such. I think it's the light sensitivity that's causing you the issues. Alright, so are you happy for me if I send a referral for you to get your eyes tested? Yeah? Okay. So you should be able to have this done in a few weeks, if not sooner. There we go. And how do you feel other than that? Everything else that we done all good? Yeah. Yeah, I'm not concerned at all regarding anything else. So that should help. There we go. I'll get that sent off for you, and you should hear back in the post. You'll get a letter for your appointment. Okay. Alright. Well, take care. And, if anything gets worse or you need to come back, please do. Okay? Alright. Well, take care. Bye-bye. Bye-bye.